Thanks, Dr. Saad, for this great chance, really, through the mega online course. I'm just Dr. Muhammad Hassan. I'm working now as a senior registrar in Children's Hospital Ireland at Cromlin Hospital, and I was working as a consultant of anesthesia and intensive care in Egypt at the Durable Hearts Research Institute. So today we are going to talk about a very important topic, which is communication skills. It will be the second lecture today. It's not an important lecture just for anesthesiologist or intensivist, but I think it will be a very, very important lecture and important topic for all of the healthcare professionals, because every day we are dealing with a lot of difficult situations and we face difficulties in communicating sometimes with some of the patients, how we can deliver something like bad news or breaking news and all of this stuff. So today, through this lecture, we'll talk about a very important topic of our communication skills. We have today three of our brilliant presenters. We have Dr. Haytham Algameel, we have Dr. Amr Muhammad, and Dr. Muhammad Ott. All of them will present to us a very important topics regarding the communication skills and how you can communicate and how can you deliver your message to the patient or to the relative and so on. So we will start today with Dr. Haytham Algameel. He's consultant of cardiothoracic anesthesia in Aberdeen Royal Infirmary Hospital in UK, and he was holding the position of assistant professor of anesthesia and consultant of cardiothoracic anesthesia in King Fahd University Hospital in Saudi Arabia. So he will talk to us about communication within the workplace, how we communicate with our colleague, how we can communicate with the consultant that we're working with. And I think it's one of the most important topic also for the communication skills. So Dr. Haytham, you can start your lecture now.
Thank you very much, to Muhammad, really, for your nice presentation. And it's a very, really informative. And allow me, in the beginning of my lecture, to start really with conduct my gratitude and my appreciation for my earlier colleagues who really present a very nice presentation that makes really the things really very nice and very well prepared for us, and definitely to make our presentation more easier. So those skills and my talk definitely will be a continuation for their efforts in the earlier course. I will start just to keep myself in the time frame. Definitely, to start with, is communication in the medical act. Definitely, it's an active process that really requires the transmission and the reception of information, and this is really very theoretical. And definitely, most of the healthcare system now becomes more advanced and more complex, and the patient expectation from the health service throughout the entire world definitely is evolving very fast. And those communication, especially the skillful communication and the efficient communication, plays a crucial role in the sustainability of the strategy. And definitely there is a challenging issues that might really cause a lack of effective communications, and definitely it requires the organization really to take further action in order to maintain. To talk about the benefits and risks, actually, very simply, we have like benefits for the patients and definitely benefits for the team as well. So for the patients, definitely, if the patients have has been enrolled in an experience with a good facility that implement the effective communication skills or effective communication process, definitely the patient will be more satisfied, and it would reflect a very positive experience, and might reduce the risk of human and system errors, and this definitely will be improving the diagnostic accuracy. And I was telling that actually for patient satisfaction, definitely we have a very positive experience if in case of the patient is actually exposed to the an effective communication skills that have been implemented in some of the let me say some of the facilities that he's been enrolled in or been definitely he's been having a very great experience, and it's actually been reflected also in the implementing an effective treatment protocols, and finally it secures the patient's safety. For our team, definitely this would really secure a positive relationships within the team, and this been adding a more team satisfaction, and this will definitely improve the job satisfaction and be reflected on the reduction of the job turnover. And moreover, this will, if we consider the nurses one of the really important components of those smoothly running system, they will be more self-confident, and this is will maintain the professional and standard career prospects. And if we consider, I mean, the system is a very big machine that really contain a lot of components, like the gears, and to keep it running very smoothly, we need actually the method, and need to implement an effective communication in order to maintain this. On the other hand, if we have risk that maybe could be really obtained in case of we have an ineffective communication or lack of the efficient communication, that's be reflected on the patient in the form of having a long waiting time, improper diagnosis, having medical errors or mistakes, and impairment of the follow-up. And this definitely will be affecting the possibility to conduct a good clinical decision, and will be reflected also in the improper clinical outcome at the end. To reflect that, for about the risk, I mean, to reflect that's really one of the main reflections here. If you look for that the negative impact of the poor communication being really a massively one of the third causes of deaths, and one of the actually the most negative impacts of this infective is being reflected, that it might be even the third cause of death in many countries, especially in the United States. And you can check this actually in the BMJ in 2016, one of the actually amazing reports, that it might be the third cause, and moreover, it might be 50% actually of the death is caused by mainly by inadequate communication skills or ineffective communication skills. And even one of the reports here has been published by Johns Hopkins University, showing that most of the deaths caused by the medical error are mainly because of the ineffective communication. And again, they emphasize on the fact that the medical error, the third cause of this, that even after the cancer and heart diseases. And you can easily check that actually that's a very huge, and loads of death is caused by the medical error, and due to the negative impact, as a result of the negative impact of the effective communication. In one of the retrospective reviews showing that almost 14,000 deaths is caused by the lack of communication, or let me say the communication errors, and it's almost twice the errors caused by the inadequate clinical skills. So it's really significant. And if we consider the cost also, one of the main impacts of the ineffective communication, you can check that actually 1.7, which the huge funds is being really considered as a cost of this ineffective communication. But however, these communication errors are often could be preventable and easy to fix. The first thing actually here is to check the red flags, and those red flags are the point that it might really attract the negative impacts, or let me say, but be missed whenever we have a communicative process. And actually, this will be should be tackled in order to be considered as a form of red flags, and moreover, it should be really taken in consideration whenever we would try to implement an effective communicative skills. But it starts from the language, treatment doses, whenever you do handover, the medical treatment, whenever it's been prescribed in the form of the blood transfusion, messes about during the resuscitation, during the emergencies and stressful situations, and during the handover, or finally in the end of life care as well. However, how we can this is our main concern in how I maintain that we need just to implement this effective communicative skills in order to avoid those red flags. Simply, it is a message, or let me say the process starts from sending a message, receiving through a media, and getting a feedback. And those actually, I mean, has been usually maintained in all the conditions of whenever communication has been required. And moreover, the sender and receiver should really reach a clear mutual understanding for the exchange information in a very organized manner. However, this could be actually varies around the world from according to the culture, according to the internal policies, according to the targets or the expectation of the trust whenever you work in, or whenever you try wants the employees to implement a particular policies in order to maintain the successful or the success of those communicative skills. However, we generically, I mean, we should include the definition of the goals and our expectations in order to maintain adequate communicative skills and ensure the delivery of our message, and definitely choosing the proper format and the good media as well. I will consider here that the message, in order to achieve a good message, we should consider 7 C's. And the message should be clear, concise, concrete. I mean, it's very, very precise, correct, complete, and courteous. And it should also consider a kind of sentimental background as well. And it should be, whenever you try to send the message, you should really, it starts with an active listening in order to get an active understanding for the message you receive. And accordingly, you'll be motivating the speaker to speak more, and moreover, you can proceed to the next step whenever you want to maintain the accuracy. So the structured communication techniques are mainly targeting to ensure the accuracy. And those structured communications serve the same purpose of the clinical practice guidelines. So it's really quite important. And definitely it will help the clinician to maintain a good ability to give a good decision and to take proper action as well. Definitely, I would consider that the patients definitely will ask you for, whenever they are trying to communicate with you, definitely they are looking for your empathy and sympathy. However, your colleague will definitely will ask you for a little bit more than the empathy. Actually, he wants you to be more responsive for his for whenever you listen to his message, and is waiting for your action as well. This actions comes actually in the form of your, I mean, your colleague definitely are waiting for your availability, and availability is something should be added to the empathy to involve the consideration of having an intrinsic attribute for even for the medical or even for the non-medical issues that will be sorted out between you and your member of a team, or between you and your colleagues within the workplace. The intra-hospital communication mainly relies on the collaboration. So the collaboration between the colleagues definitely also depends on your availability. So it's a kind of a couple of gears has been rolling together in order to constantly create a system that will operate very smoothly, and those collaboration between the colleagues definitely includes also the adequate entry of precise informations. So it's a clear message should be maintained. They will ask you, or I mean, they are waiting for flexibility as well. And this flexibility have loads of meanings. It starts mainly from your ability to modify your work scope, your job plans, your delegates, in order to cope with the teamwork needs or requirements. And moreover, you can deal they are actually definitely how you will deal with their feedbacks in a very instructive and a very positive.
Dr.
And this is one of the main things that really needs to be maintained throughout our experience. One of the good examples for that is the time of the COVID. Whenever it's been asked, or most of us actually we've been asked to change our job plans and to improve our ability really to work under loads of pressure and to give us support, a very instant, continuous support for our colleagues and for our teams in the hard time. And I think really it might a little bit stay for a bit longer. However, I think the main targets here for any kind of communication throughout the world, or for any kind of facility, depends mainly on a lot of let me say, a lot of targets. And the main targets here is to maintain the accuracy and the quality of delivery of your message. You are waiting for the response as well. Your colleagues and your teams are waiting for your availability and your flexibility, and you should be prepared for the alternatives. All our works together as different components in order to keep the system running smoothly. The targets here, it might goes beyond the verbal message to go for the non-verbal communication and gesture signals as well. And I think my colleagues are giving a very, very good really explanation for that in the last session. However, the face-to-face communication keeps definitely everyone, even the remote staff, keeps all of them are involved in this communication process. And definitely we're expecting that the facial expressions might be monitored, and just we can know if you send a message is really not delightable a bit from your colleague, and definitely you can manage really to know if you need to amend something or need to do another message, or to check for the alternative, or maybe check for your plans. Definitely you can express this. I mean, you can figure out this definitely from the frustration, or like if you found your colleagues unmotivated. Definitely you should really watch your hand movement, because in different cultures, in different let me say, in different setups, the hand movement could be misinterpreted. We should keep really natural eye contact as well between the people who are really receiving your message, and this definitely will improve your ability to feel that you are confident, and this definitely will be reflected to your colleagues as well. The tone of your speech as well should be carefully tuned in order, and should be adjusted carefully just to make sure that you are giving the correct interpretation for your message. In the time of the COVID again, we lost a lot of me myself. I just find it a little bit difficult. I mean, to hear. So sometimes I ask my colleagues to repeat the message again in order to make sure that you get a clear understanding, clear interpretation for what they need or what they mean. And maybe this will be make many people now currently, especially at the time of the COVID, and there's loads of pressure, really relying on the hand gesture rather than staying to get the informations through reading the lips or from the listening. We need actually to be more familiarized with the virtual communication, the form of a Zoom, the form of the Google meetings or Teams or whatever. And this virtual communication actually should be taken as a face value as well, and it actually should be a kind of a method or a media that it should be, most of the people should be really able to use it in a particular way, and definitely to conduct their message through. And in case of you need to have to get a better confirmation, you can just ask to recap or just to repeat the message, because technical issue like the one I'm having now, actually it could be make the message not being delivered clearly. The main thing, whenever you have someone is joining the team, and a new member is joining the team, or you've been asked really to join another team, I've been as the form of the multidisciplinary teams, and that's what makes really adds a pressure on you just to prove yourself, and definitely this will make you able to conduct all the efforts to learn the names of the staff within your team, and encourage the rest of the team definitely to be very familiar with you, to know how you like to be addressed, and if not, try to be proactive, introduce yourself, introduce your title. These are kind of a breaking for the ice, especially when you are joining a new team. Definitely, we have a magic words really should be considered whenever you try to communicate with your team or with your colleagues or with even with the new members, saying please, thank you, and sorry. And whenever you talk for the colleagues about anything, you can just try to open in order to break the ice as well, which can be considered actually a magical attitude or a magical approach that you can talk about things like sports, weather, or family, and keep it light. Don't don't enter into a personal or political or don't talk about the ethnicity or religion or beliefs. Definitely, and by the way, don't talk about Zamalek as well, because I know a lot of my friends maybe will be really upset if we consider the Zamalek as well whenever we talk about the leagues or whatever. However, let's go moreover for ability for us actually to be enrolled in the multidisciplinary teams, which is very a huge concerns whenever you are trying to join those multidisciplinary teams or multi-professional teams. And it's one of our duties as well to keep our ability to be more flexible, more tidy up with them in order to maintain a good communicative skills and to maintain a good relationships with our nursing staff, because we consider definitely the nursing staff are a crucial, or let me say, a cornerstones for our multidisciplinary teams. Whenever you try to talk to senior colleagues, you should really ask them how do you like to be addressed. You can ask him for help and guidance. You have loads of experiences, especially we can get them involved in them whenever we have an error, just to be sorted out whenever we have an emergency situation or stressful situation, and consider also the senior overseas colleagues, because we have a fountain of knowledge, and they've been enrolled in many emergency situations before. So actually, they're definitely 90% of their judgment are should consider very highly correct. Actually the need for those communicative skills are being emphasized more in case of you have emergency situation. You should be, because everyone is waiting for your ability to cope with this stressful situation, and definitely they are expecting that you might be able to show your ability to be less hesitant and to give a right decision in the right time. As long as you are dealing with the emergency situation, definitely we are relying on the ABC protocol for airway, breathing, circulation. Here also we have an ABC protocol. It starts with the being assertive, accurate, and never assume anything. Try to utilize your body language and your tone in a proper way. Speak clearly and concisely. Diagnose the problem and try to do a correction for the error, and show your flexibility. Goals and plans should be defined and should be determined from the beginning, because we need to be assertive, because it's actually time is essential in this situation, and assertiveness is being considered, is being explained to be a direct and appropriate taking of the responsibility whenever be needed, and you might be able to ask for advice if you are uncertain. However, the main thing and the main team will be actually keeping you under the scope of being organized or not. To do that, simply you can go for simulation and training, and that's actually the main purpose of having a good simulation and training courses, that will actually expose you for this experience in a virtual way, and definitely whenever you've been exposed to it, you can manage how to do it in a proper way as well. Whenever you be in an emergency, try to show that you are be able to take the control if you are in charge, definitely, and clarify the rules of your team. Try to check the names of your staff if you can't recall it, and explain your plan and goals directly for your team. Have all the information in case of you need to use a phone call, or you need to conduct informations or to communicate with the phone. Have all the information you don't have in your hand. You don't have to go and just try to figure out the information that's been asked in the phone. Try to be concise and clear, and definitely think about what you are going to say before you start the conversation, and it might be repetition might be needed. because in the time of the stress, definitely not all of us are be able really to catch or to grasp all the information or grasp all the data. And also, whenever you try to keep the eye contact when you see the one after you see the one who's been able to involved in this conversation as well. Watch your body language carefully, because whenever you've been watched especially when you are new in the team, the anxiety or the aggression could be leads actually to the disagreement, and definitely your colleagues as well on the other side definitely will consider this as a kind of disagreement or aggression. So it should be very carefully watched by body language. To reach the conclusion, definitely, whenever you have an organization with a strong communicative policies, definitely this will ensure the patient's well-being, and the healthcare professional definitely you should recognize the importance of having an effective communicative skills and effective communicating process in order to thrive. The effective simply is a mutual understanding and exchanging for the informations. We can really, when using the effective communicative skills and effective communicating process, definitely will be easy. It could prevent a lot of hazards, including patient death. And remember that we don't have to spin between the gears or the wheels in order to keep the system running smoothly. Our duty here is to keep our communicative skills, our communication efficient enough to thrive and to avoid the system failure. Thank you very much for your patience with me. I'm sorry for this really bad technical issues. Thank you very much.
Thanks, Dr. Haytham, for your nice presentation, really. And it was very informative regarding the targets to achieve with the 7C, which I found it is very helpful for everyone. Also, you addressed a very important aspect about the communication when we join a new team, because here in Ireland or even in UK, I think there may be a rotation every 6 months to 1 year. So that's why it's very important to know how to communicate with other team members, especially if there is high turnover between different teams. So it was really very interesting and very important aspect also to address. We have here one questions about is there any difference in the communication between normal circumstances and if we are dealing with any of the emergency conditions? Is there any difference in the communications?
Yeah, thank you for the question. A very nice question, actually. Definitely, at the time of the emergencies, all the people are under stress, and definitely, especially if you are newly joining this team, everybody expecting and putting a kind of let me say a pressure on you. Just they need you actually to be able to conduct the decisions in order to maintain an adequate goals at the beginning. So that's why the best thing is, first of all, is try to explain for your team the plans, your goals, your expectation loudly in front of them, and definitely wait for show your flexibility, wait for the advice, show that you are available and flexible as well, and you are ready for any guidance. Definitely this will be helpful in order just to match with the team goals, and also to merge easily in the in your team. In the time of whenever we have an elective surgeries, or in the time of let me say of an easy times, or like the time whenever we are not under stress situation, we can manage. Actually, we have enough time to deal and to delegate and just to ask for advice. But in the stressful situation, you need to be very well trained. You should expose yourself. You should be able to manage this stressful situation based on your simulative. I mean, being involved in many simulations or training courses, and that's what makes really the condition very easy for you. I mean, to deal with and to delegate with other team as well members.
Thanks again, Dr. Haytham, for your discussion and very informative presentation. I think we don't have any other questions, so thanks again for your help today and with this nice and informative presentation.